Hey everybody, it's Dr. Kadisha, your board certified emergency medicine physician, author of the best-selling book, Help Us Help You in the Emergency Room, and creator of the Mini Mobile MD Kit. And I'm here to discuss sexual safety with you just in time for Valentine's Day. Now, I know a lot of you think you know a lot about sex, but as an emergency medicine physician, I'm seeing my share of people in the ER who seem to have had some misunderstandings about sexual safety, or they at least forgot some things about sexual safety. I know you think this might be a bit of a preachy, um, perspective that I'm coming from, but actually, if you know what it's like to tell a woman who just reconciled with her husband that she now has chlamydia, or if you know what it might be like to tell a 15-year-old girl and her mother that she might have herpes, then you would know what was driving me to do this discussion. Especially with Valentine's Day coming, there's a lot of people feel a lot of pressure to be romantic and intimate, things like that. And I want us to have I guess, a sexually healthy approach to that. And you might wonder what sexual health is. Sexual health is more than just the absence of disease or the absence of infirmity, the inability to carry out the sexual act. According to the World Health Organization, sexual health also involves a mental, emotional, and socially healthy regard towards sexuality. So I know I'm getting right into it. I do want to wait a few minutes for people to join in, and those who join in, definitely let me know that you're here by just saying hi in the comments. Definitely feel free to express any questions or concerns, or share any knowledge or experiences that you might have or a friend might have had. So we'll just give it a few minutes. And I'm going to post some information here. So if you want to get my free download on Safe Sex Facts, you can go to this website here, safesex2021.com, and also register for the webinar that I'm going to give on February 18th, which is right in the middle of Condom Week. We definitely need to keep the condom conversation going. Believe it or not, you might know everything about condoms, but your friends might not know everything about condoms. Your partner might not know everything about condoms. So I think we need a little bit of a refresher, because it's often enough that we are seeing people in the ER with various sexual complaints, issues, or concerns. So let me just pause a little bit. And I also want to provide some information on, as far as the various health departments where you can get free or very affordable HIV and other STD testing done for yourself and or your partner. One great way to start a relationship is by actually going to get tested on a date. So you can make sure that you both are starting off with a clean slate. So here's the Houston Health Department's phone number. Okay, and I want to give a special shout out to the New York Health Department. They posted some very good sexual safety guidelines that also include sexual safety guidelines, especially for this pandemic. And again, yeah, definitely check out my free download and sign up for my webinar next week on February 18th, same time, same place, 8 p.m. Central Standard Time. Actually, I think we're going to do that on Zoom. And all you have to do is go to this website, www.safesex2021.com, and actually it's an ebook that I'm offering. Okay, so it's been about 6 minutes, so we'll get started. And, if you happen to jump in later in the broadcast, definitely type in hashtag replay. Do hit like, do hit share. It's not a big deal if you miss the live. You can still continue the discussion in the comments. But the first message I wanted to bring across is that, again, sex is more about being physically ready. It's about being emotionally ready, mentally ready, and even socially ready to engage in that act. Hey, Victoria, thank you so much for coming on. Thank you so much for being the first person to join. Please hit share, hit like, express any concerns or questions, or feel free to share any knowledge or thoughts, insight. That would be greatly appreciated. So one thing I definitely want to address first is the tendency for the responsibility of birth control to be laid at the feet of women. It's not just a female responsibility, it's also a male responsibility. That is part of sexual health and sexual safety, that you look at it as a partnership where each adult shares equal responsibility for their safety and that of their partner. Okay. Okay. And why are we discussing this also today? Not to be preachy or anything, but Valentine's Day is coming up. People are going to be, regardless of the pandemic, folks are still going to be gathering. Folks are still going to be drinking, mingling, and things like that. And it tends to, lower your inhibitions. Some of us might end up engaging in activities that we had no plans for. And I just want to just kind of lay a mental foundation for people going into the weekend, because you only have to have unprotected sex once to get a sexually transmitted infection, or to get pregnant, or get your partner pregnant. So just these few seconds of a lapse of judgment can change a person's, it can be a life changing decision or occurrence that happens just because of a few seconds of lapse judgment. So just to talk about condoms, that's the first thing. First, condoms are a form of barrier contraception, and they create that protective barrier around the penis, reducing the risk of both pregnancy and sexually transmitted infections. However, um, I don't know if they still make these, but there are lambskin condoms out there that you must avoid. Latex is preferred. Polyurethane condoms are out there also for those who have a latex allergy. And female condoms are also made of polyurethane. So there is an option there. So if someone says to you that they're allergic to latex, tell them that polyurethane is an option also. Another thing with condom use is to not use oil-based lubricants. They can sometimes break down the condoms, so it's better to use like silicone or water-based lubricants. And store your condoms in a cool, dry place. Avoid exposing them to heat, or like in a wallet or a glove compartment. Check, if that's where you store your condoms, check on them frequently just to make sure that they are still intact and that they haven't expired, because they're more likely to tear if you don't store them properly. Okay. So again, yeah, definitely go to www.safesex2021.com to get that free ebook of mine called Safe Sex Facts, and to join me on February 18th next week, and where we'll go into, we'll have a more in-depth discussion about the need for sexual safety. We'll discuss intimate partner violence. We'll also discuss the various symptoms of some of the more common STDs, which are listed in my ebook tonight. And hopefully we'll have more of a interactive discussion. So why don't I go into some information provided by the New York Department of Health, which was really, really good. They've been on the cutting edge of the COVID-19 pandemic. Well, they've actually come up with some guidelines for folks who may engage in sex with someone other than their intimate partner during the pandemic. Okay, so um, what they want to offer is strategies to reduce the risk of spreading COVID-19 during sex, and it's harm reduction strategies also to reduce the risk to yourself, your partners, and your community. So, of course, we know how COVID-19 spreads. It spreads through particles in the saliva, the mucus, or breath of people with COVID-19, even from people who don't have symptoms. Um, However, while we know that, there's still a lot to learn about COVID-19 and sex. Now, the virus has been found in the semen and feces, or poop, of people with COVID-19. They don't know if COVID-19 can be spread through vaginal or anal sex. It's not known quite yet. And it's not quite known if well, it is the coronaviruses, I'll let you know. While we say we don't have enough information on coronaviruses were first discovered in 1930. It's 2021. So we have about 91 years of research knowledge on coronaviruses. I'll just say that. And it is known that coronaviruses do not spread easily through sex. So sex is not a common way by which COVID-19 spreads. So if that's any kind of comfort, just know that, but don't hang your hat entirely on that. It's advised that you only have sex with those close to you, and the New York Health Department ventures to say that you are your safest sex partner, and that's general knowledge. Masturbation won't spread COVID-19, especially if you wash your hands in any sex toys with soap and water for at least 20 seconds before and after sex. The next safest partner is someone you live with, a close contact, or and it's funny, they do mention having sex only with consenting partners. Of course, that goes without saying. But regarding someone outside of your household, um, try to just have one partner. Pick someone who you trust, that you know well. in order to get to know that person better, talk about COVID-19 risk factors, just as you would discuss, pre-exposure prophylaxis, which is PrEP for HIV, just as you would discuss condom use and other safer sex topics. Ask that person about COVID-19 before you hook up. Ask that person, have you had any symptoms in the last 14 days? Most people with COVID-19 do have symptoms, but yes, asymptomatic spread is possible. Fever, cough, sore throat, shortness of breath are symptoms to ask about. And commonly, the folks that I've seen in the ER who go on to be test positive for COVID-19, they often have fever and a cough, sore throat and a cough, fever, body aches, shortness of breath, things like that. That's right, Victoria. So no booty calls unless it's a booty call with somebody that you know well. People who've recovered from COVID-19 at least 10 days from the day that their symptoms started and who've not had fever for at least 3 days are considered to be less likely to be infectious. If that's something that you want to consider. Another thing you can do is actually, go get tested together. You could go get rapid testing together for COVID-19. Definitely call your local health departments. And again, I'll put some of these numbers up. Like there's the Houston Health Department. And there's the New York Health Department. Okay. I'll just go back to Houston since that's where I am. And if you, if you've met someone online and you're planning on having sex, consider taking a break from in-person dates. Try video dates, sexting, subscription-based fan platforms like OnlyFans, or you can do, like a sexy Zoom date or a chat room. Those might be options that you can use for social distance dating. So, and if that's not enough for you, if the social distance dating isn't enough for you, consider closely monitoring yourself for symptoms. Consider getting a swab or saliva test for COVID-19 on a more frequent basis, be it monthly or within 5 to 7 days after a hookup. If you're in New York, you can call 311 for information on where you can get tested. In Houston, you can call 832-393-4220 for testing locations. And take precautions interacting with people at risk for severe COVID-19, people over 65 years of age. So if by any chance you're considering dating someone over the age of 65 or someone over the age of 65 is pursuing you, take into consideration their vulnerability to more severe illness. And then for those who aren't 65 or over, there's still people at all ages who might have serious medical conditions like asthma or diabetes or heart disease. Take that into consideration. Even if they don't want to, sometimes our desire might lessen our judgment. You might have to be considerate of their medical conditions for them. And also be vigilant with face coverings, again, and healthy hygiene to minimize risk. Now, and it's funny about masks because, kissing, of course, can easily pass the virus. So, if you're going to engage in sexual activity, maybe, avoid kissing if you're not going to wear a mask. Avoid kissing that person if they're not a part of your small circle of close contacts. But and Consider wearing a face covering or a face mask. Maybe it's already your thing to wear a face mask, maybe not, but during COVID-19, wearing a face covering that covers your nose and mouth, even during sex, isn't entirely unreasonable. Okay, because heavy breathing and panting can spread the virus further. And if you or your partner have COVID-19 and don't know it, a mask can help stop that spread. So, maybe while you're waiting for the results of a PCR test, you could consider, if you can't practice abstinence, consider engaging with a condom, of course, but also with a mask to help prevent spread. Also, another thing that you can consider is masturbating together, using physical distance and face coverings while masturbating together. That's also another safe way. At least, you're in the same room, but you're still doing a social distance activity. Also, condoms and dental dams can reduce contact with saliva, feces, or semen during oral or anal sex. That's another consideration. And definitely, again, can wash up before and after sex. That is more important than ever. Against the same old thing, washing your hands with soap and water for at least 20 seconds, washing any sex toys with soap and warm water, again, at least for 20 seconds. And if this is a digital date, disinfect keyboards and touch screens that you are sharing with others. And this is one thing that that should go without saying, but skip sex if you're not feeling well. If you are even starting to feel unwell, avoid kissing, sex, or any close contact with others. If you've been exposed to someone with COVID-19, avoid close contact with anyone outside your household, and follow your state and local health department's guidance about how to prevent exposing others. But we've gone over some of that here. People exposed to COVID-19 should get tested for the virus using either a swab or a saliva test. It depends on where you go. Both are equally effective. Now, if your partner or yourself have, again, a medical condition that makes you vulnerable to severe COVID-19 illness, you might also want to skip sex. And those medical conditions include lung disease, moderate to severe asthma, heart disease, diabetes, obesity, kidney disease, liver disease, cancer, or any kind of weakened immune system. Say if you're a transplant patient, or if you have unsuppressed HIV or a low CD4 count for some other reason. And also, again, and just as important as ever is the prevention of HIV. You do not want to contract an illness that compromises your immune system, especially during this time. You want to prevent HIV, other STIs, as STIs increase our vulnerability to HIV infection, and we want to avoid unintended pregnancies. We want to avoid anything that could land us in the ER or the hospital unnecessarily. So, for HIV, use condoms, take pre-exposure prophylaxis, also known as PrEP. And, aim for, if you're HIV positive, having an undetectable viral load. All of those things will help prevent HIV. Other sexually transmitted infections, use condoms if you can't be abstinent. If you can't be absolutely abstinent, consider social distance dating or, co-masturbation in the same room at a distance, things like that. And, if you haven't gotten tested for any STDs or STIs, because a lot of times folks can carry certain diseases, especially chlamydia and gonorrhea, or you might go for a very long time without having a herpes outbreak and, think that you might not have it anymore. Why not touch base with your local health clinic to see what your status is regarding these diseases, whether you're male or female? And I know, it's not a routine thing for men to get tested for STDs. It's, part of a woman's wellness check to get tested for STDs. But I really disagree with that. I think men should get tested for STDs regularly as well. So definitely, so there's the Houston Health Department. And again, there's the New York Health Department. And all you have to do is Google your local health department. I thought I had the DC Health Department, but you can definitely Google that. And for my friends in Philly, who might not have insurance or don't want to go to the hospital, definitely check out your city health departments for free testing. If I remember correctly, when I worked in Philadelphia, there was a health clinic on Broad Street, north of Washington Avenue, like a few blocks north of Washington Avenue, where you could go get free or very affordable STD testing. So if you're heading south on Broad Street, it would be on your right-hand side as you're headed towards Washington Avenue. Okay, let's see. But that's right, Victoria. No booty calls. This is not the time for booty calls. And one thing I love about New York's guidelines is that they talk about people who find 3 or more people, to be a sexual option. Yeah. Let me. Okay, so the New York Health Department says, hey, if you have to, and if you like to engage in sex in large gatherings of any type, are considered not safe during the COVID-19 pandemic. I'm like, when are they ever like really, really sexually safe? These group sexual settings, but especially now, close contact with multiple people should be avoided. But if you decide to find a crowd, according to the New York Health Department, here are some tips that they offer to reduce your risk of spreading or getting COVID-19. Number 1, limit the size of your guest list. Keep it intimate. How about having them get tested and have results, within a certain amount of time, like within the last week or so? Go with a consistent sex partner. I'm like, where are you going? I can only imagine. Another thing is picking larger, more open, well-ventilated spaces. Larger, more open, ventilated spaces to have engage in sexual activity with more than one person. Okay, it happens. It happens. I'm an ER doc. I've seen it all. I've had to help people past a number of sexual horror stories that I'll discuss on February 18th. Again, sign up for my webinar on February 18th and get your free download here. And we're going to talk about sexual horror stories, STDs, and more. Okay, and then another thing is they said, wear that face covering, avoid kissing, and why not? Why? I mean, I'm sure costumes might even be an option in these large gatherings of people. Victoria says, I think sex ed or sexual health, COVID or no COVID, should be taught at an early age. regardless. Definitely. Yeah, especially right now, sex ed should definitely include how to conduct oneself during this pandemic. And sex isn't all about intercourse. Again, it's a mental thing, it's an emotional thing, it can be a social thing. Sex starts in the mind, and yeah, can't say it any better. Why not get the education first and have a holistic view of sexual health before even getting on that road at an earlier age? Okay, so if you meet your sex partners online, or if you happen to be a sex worker, like this is really real. If you happen to make a living by having sex, consider taking a break again from in person dates, video dates, sexting. Again, subscription based fan platforms. A lot of people are doing OnlyFans, and sexy Zoom parties or chat rooms might be your option. And lastly, since we're going on 30 minutes here, I will just say, um, if you're going to engage in oral sex, help protect your mouth by having your partner use a condom, be it male or female. Maybe avoid getting too intoxicated so that you decrease your chance that you decrease your chances of participating in high risk sex. And I remember there were some urban myths that were going around when I was a teenager about various things women could douche with after intercourse. I won't say what that was, because I don't even want to speak that into the universe. But women should not douche after intercourse. It doesn't protect against STIs, and it can also spread an infection further into the reproductive tract. And if you did use any kind of spermicidal protection, douching after intercourse could also wash that away. So douching after intercourse is not helpful. Also have regular pap smears, pelvic exams, periodic tests for STIs. Speak with your primary care physician. And again, if you don't have a primary care physician or you don't have insurance, do contact your local health clinics, your health systems, the health departments. Do take advantage of these clinics that offer free or affordable medical care. Check your body frequently for signs of sores, blisters, rash, or discharge. And I know we tend not to do so with our partners, but you should also be aware of your partner's body. Look for signs of sores, blisters, rashes, or discharge. Don't be afraid. And don't turn off the lights so quickly. Don't turn off the lights so quickly. So again, I just want to thank you guys. Thank you so much, Victoria, for joining me. Please hit share, hit hashtag replay. If you are watching this once the live is over, hit like, hit share, and get my free ebook at www.safesex21.com. And I hope that your Valentine's Day is fun, but also safe. Bye. And again, I'm Dr. Kadisha. Check me out at www.drkadishamd.com and get that free ebook. Join me February 18th. Take care. Bye.